Yeah, so I'm presenting this project on behalf of one of our green team competitions, actually the winners of our green team competition. And this is a reusable tourniquet for sustainable phlebotomy. And I need to give a shout out to Rebecca Palmer, the Quality and Improvement Lead in South Yorkshire Regional Services, and to Lee Lindley, who is the sister in cardiology outpatients. So in terms of the Green Team project, Sheffield Teaching Hospitals have a strategic aim of being a sustainable organisation, and we have the capability of minimising any adverse effect on society and the natural environment. So this Green Team project, one of the kind of benefits from it was that it inspired and empowered the team, and they really felt like they could make a difference. So looking at the system, there was poor quality in the single-use tourniquets. They were of poor quality. They caused some distress to some of our patients, especially the frail patients with nipping of the skin. So there's poor patient and staff experience. And our staff are really, and like all staff, very passionate about their patients' clinical care. So the specific project aims were to replace single-use tourniquets with the reusable ones in one of our directorates within the hospital. So that includes cardiology, vascular and renal services, and then using the SusQI methodology to look at the benefits for the patients on a clinical and social outcomes, while obviously trying to reduce our environmental harm and look at the financial costs associated or savings associated with that. And then the long-term plan was to kind of make this into a trust-wide initiative, and also share it across the Yorkshire and Humber National Kidney Network and also the sustainability networks. So the 10-week journey of transformation, so initially started with kind of stakeholder engagement. There was patient and staff conversations and surveys. We got endorsement from our triumvirate, so our management team and the matrons, and also from infection prevention and control, because that was kind of a real thing that we needed a steer from them to ensure that moving from something that's single use to something that was reusable would be kind of an acceptable thing, kind of post-COVID. So we got that approval, and then we engaged with the procurement team, who were able to provide us with the kind of data behind how many we'll be using, and also the information about the cost of the reusable ones. So the rollout is approval across the clinical leaders. We piloted the tourniquets in the cardiac catheter suite and cardiology outpatients. And then our clinical educators supported training and education for the staff using the reusable ones, because there was slightly different kind of methodology to the tourniquets from moving from the disposable to the reusable. So in terms of the results, 100% of the patients surveyed agreed they liked the reusable or preferred the reusable options. They didn't pinch or mark their skin. And then with the renal patients, this allowed us to kind of preserve the vascular access for the patients, which is a real, concern with their long-term health conditions. In terms of social value, it's a better quality option for the patient. The staff agreed, so it made their lives a lot easier. They felt like they were making a difference in terms of reducing waste and the carbon emissions in the department. And this is a suitable kind of system-wide change that we could roll out across the whole organisation. Financial savings, just to the directorate alone, that was just over £6,500, and then a trust-wide, if implemented across the trust, would be nearly £34,000. So a good kind of financial saving. And then the carbon savings was just over 1,000 kilograms of CO2, equivalent to 3,123 miles in a car. And then if we roll this out kind of trust-wide, that's 25 kilograms of CO2 and 73,500 miles in a car. So great kind of impact there. So the key learning was, that the staff had a voice. They were able to get involved in the project, and we were able to listen to what matters to them and what matters to the patients. And obviously quality and safety is an important factor to consider, and the education, training and learning. But not only did it provide benefits in terms of learning and education about the tourniquets, but it did allow us and gave us the opportunity to talk about the environmental impacts of our healthcare delivery, really, and what that means, but also then try and raise awareness about our own trust sustainability plan and the themes within that, and actually what it means to staff providing clinical care. Because that often, you know, that gets missed in terms of we have this policy, but how does that translate into on the ground, patient facing, you know, staff providing care? So we were able to do some of that and some of that education. So that was kind of a really good benefit from the project. We considered the risks, and then we're looking at sharing this wider across the trust. So in terms of what we've done since, the team have made presentations to our infection prevention and control link workers to kind of get buy-in from them to be able to roll that out effectively and efficiently across the organisation. We've also been to an ICB sustainability meeting and presented there, and also a procurement meeting. And from posting our reports on the Centre for Sustainable Health, we were contacted by South Warwickshire University Foundation Trust to talk through how we went about the project and how we went about implementing it. So currently we're looking at training, doing a video for staff training and education. And then we've rolled it out across the South Yorkshire Regional Services, in some theatres, in the infectious diseases and critical care, and our Rivermead Training Centre. And so we're planning that further rollout across the trust, but it's kind of a bit slow and steady. So a big impact started with a small idea. So thank you.